I think to be in healthcare in general, mentorship is very, very critical. Taking care of patients, to have the trust of the public, you need a few mentors to give you a different feedback, different points of view, to broaden the way you look at the path that you're taking, to learn from their experiences, also continually to remind you of the privilege of being a healthcare provider and what that means in treating the public.
I think that taking a moment to see and to think about how you can be generous to your mentee and the ways you can be generous can really make a difference on their career, and it certainly has made a difference in mine. I've been the recipient of incredible generosity from mentors and colleagues, and I try to pay that forward.
Your attitude, not your aptitude, that will determine your altitude. I do think that it's what you bring to the table in terms of your attitude, your excitement, your passions, your desire just to do good, which is much more important than a score on a test or how well you can perform. And that's what people and patients actually care about. They care that their doctor cares about them. And while you need to have the grades and whatever, I think that a strong attitude is what really matters.
I think when anyone is trying to pursue a field kind of as challenging as something like dentistry or medicine, the biggest thing is persistence and recognizing that even if you have some ideal plan of how things are going to go, that rarely happens, and that's not a bad thing. I was a better dental student because I went to grad school, and I'm going to be a better surgeon down the line because I'm doing a one-year intern program. Two things that were not part of my plan. But overall, I think that persistence and recognizing that we'll get where we're meant to be in the end is one of the most important things.
All those late nights or hours spent studying or reading, practicing for our exams, or even getting in the OR and getting experience, taking call on weekends, all of that is so when that patient turns to you and says, "What do you think?" that you earn that trust. And for me, that's what I try to go back to on the hard days.